I'm Dr. Vincent. This video, I'm going to talk about a common question we get, which is how long will it take to find my dose? It's impossible to answer that question, and that I guess I could just stop the video there. But so the thing is, how long will it take to find my dose is dependent upon a number of things. Some of them have to do with the antigen in question. Some of them have to do with how uncertain your situation is, and some of them have to do with your personality, you the patient. So, in terms of situation, if you say you have chronic fatigue, right, and it's a very non-specific sort of symptom, or I have fibromyalgia, same set, it's fatigue plus pain plus brain fog and depression or whatever. There are a lot of possible antigens that can cause that set of symptoms. So, because we can't have a great deal of confidence about one over the other, we oftentimes have to go through multiple different antigens to find the answer for that kind of person, for that situation, right? And that increases how long the whole process might take. If you have psoriasis, that's almost always related to one particular antigen mixture, the skin fungal mixture. It might be foods, it might be this or that, but something like that that's a lot more narrow kind of reaction problem, you've got one antigen that's very likely to be the answer, so that just speeds up the process. Another thing that's antigen based is what's the usual treatment range for that antigen. So using the same example, like with fibromyalgia kinds of things, the most common antigens are Lyme or yeast. Those antigen mixtures have a very broad dose range that I've observed affect people, anywhere from like 4C to 30C, which is this huge wide range. And so depending on how quickly you're willing to go through the dose range, that's another variable in how long this process might take. But just inherently longer for antigens like that. Whereas with the psoriasis question, with the skin fungal formula, that one usually people respond between like 5 and 8C, this really narrow dose range. So if I'm trying to figure out somebody with psoriasis, I'm probably going to figure it out within the first month, or 6 weeks in most cases. Whereas if it's a fibromyalgia kind of story without clear indicators of yeast or Lyme or parasites or foods or chemicals or whatever, obvious things standing out, we may have to go through a number of antigens through a very broad range of each one, and it might take 1.5 years to 2 years in some of those cases. What you can do to speed the process up is go through the doses faster, so we can adjust the pace by which we try different doses, and we can also start at a more realistic beginning dose. So the stronger you start in the dose range, the more likely you're going to get an answer quickly. That answer might be, oh crap, everything got worse, but at least then we would know that's the antigen you needed, right? So if we don't know one of 5 different possible antigens, and it could be any one of them in my assessment, if you pick one and we start at a pretty strong dose, and maybe we skip doses on the way through, like maybe we go like 15C for the Lyme. So that the average dose response for the Lyme and the yeast mixtures is around 15C. There's about from 12 to 18C is the usual hump of the bell curve where people most often react to those. The sicker people that are more sensitive, I might start as weak as like 25, 22, somewhere. And the people that are more robust and seem to have minor symptoms, we might start at 10 or something. It depends. So if you want an answer quicker, we start towards the stronger end of where I think you might be, and you can skip doses. You can go 15, 13, 11, 9, 7, and yes, you might jump over the right dose, but you'll get an answer. So that it depends on if you're motivated more by the desire to find out and find a solution, or if you're motivated more by a fear of flaring, because there's a risk of overdosing people, and the risk goes up if you speed through the dose range. There's a higher risk of missing the right dose and causing a flare. So circumstantially, if you work for a living and you have to support your family, or if you take care of children and you really can't afford to flare for a few weeks and be disabled potentially, then we end up starting at a weaker dilution and going slower through the pace, and it's going to take longer. That's just reality. That's how reality works. So those are some of the variables that dictate how long this might take. How certain the antigen is, therefore how many antigens you may end up having to try, how broad the dose range is for the given antigens you're trying. where you start with the dilutions and how fast you go through the possible dilutions. Where personality comes in is people who have a high degree of anxiety, have a higher degree of fear, usually rational fear because they've tried lots of treatments that may have made them worse over the years. They don't, they're afraid that this might make them worse also, which is a possibility. They start at a much weaker dose, they want to go slower, and they also, those people that have had that kind of mindset put upon them will often think that they flare from a dose that actually didn't do anything. So if we end up in that situation, you'll think you got worse, we'll wait 7 weeks, so that's like a 2-month delay every time that happens. Wait 7 weeks, try a weaker dose, and some of those people might think that that dose flares them also, maybe, which usually it doesn't. And then we wait another 7 weeks and go on. So I've gotten pretty good at reading that situation, and I've been doing this for a decade now with lots of people. I got pretty good at reading that situation. If I tell you, you know what, my guess is the doses aren't doing anything, we should go back to stronger and stronger so that we can find an answer. My advice, of course, is that you take my advice, obviously. That's a circular argument. But I've seen it enough times, I know what it looks like when people are having kind of a fear-based response and decision-making, and it makes this process take years when it should take months. Or what very often happens is you just give up. If you think you flare a few times and then you start to feel demoralized, you feel more afraid, and you decide this isn't going to work for me, I don't want to do it anymore, and then you quit, which is unfortunate if it's a treatment that may very well solve your problem. But it's, that's a personal choice. So I will do my best to help guide people through decision making and try to figure things out expeditiously, taking into context your life situation and how cautious we should be about avoiding a flare, which also depends on what your illness is. Like if you have a rash, it's not a life-threatening problem. We could kind of push the envelope and go a little faster and go, oh, my rash got worse. Not a big deal. But if somebody has like psychiatric symptoms that might make them suddenly become psychotic and run naked into traffic, you want to be more careful with that person, So those are some of the variables that will dictate how long this takes. If we get extremely lucky, the very first dose we give you will make all your symptoms go away. That might happen 1 out of 50 times. Don't expect that to happen. More typically, I tell people, let's expect about 6 months or so to find some kind of answer, like to make sure we know something that's going on. A lot of you are complicated and you need more than one antigen. And so within 6 months, hopefully we have a couple of antigens figured out. You're like, oh, okay, I know this is working, I know how this works, and you get confidence about like phasing in new antigens and making progress. And again, it really depends on the situation. So that's not a very satisfying answer to how long is this going to take, but it's the reality. And what I would say about that also is that because of that reality, some people want to go try other treatments first that offer a quicker solution or a quick fix thing. Like I'm going to do this traditional Chinese medicine protocol for a month because they said it should work. It should work within a month if it's going to. Okay, fine. That's only a month of time. If it doesn't work, I'm going to do this detox protocol for 6 months, or I'm going to go do hyperthermia in Germany or whatever. So a lot of these things offer some sort of promise of a faster response, and people want to try those things first. You may certainly do that, depending on the situation. But long term, once we find the right dose for people with LDI antigens, the long game is very high yield and is very satisfying. It's just a matter of when it seems like the thing that fits with your level of urgency, where you are in your journey. And then we do our best to figure it out and help people whenever they start this part of their journey. And that's up to you. Thanks.